Okay. Perfect. Very good. Hi, everyone. We are going to wait a few moments and have everyone join us before we get rolling. My name is Dr. Tucker. Thanks for joining us tonight. People are joining pretty quickly, so we'll get started soon. And if you didn't hear me, my name is Dr. Tucker. We're just waiting for more people to come in. All right, guys, we're going to go ahead and get started. My name's Dr. Tucker. Thanks for joining us tonight. And we didn't have the seminar series last year, but I'm thankful that we can do it in the Zoom format this time. Today's speech is going to be about caring for your geriatric horse. And then again on March 10th, we'll have grazing strategies and the metabolic horse with Dr. Slater. And then to wrap up our series on March 17th, we're going to have save time, money, and heartache with a pre-purchase exam. And that's going to be with Dr. Stoll, one of the other new vets in the practice. There's a little bit of housekeeping I'd like to do before we get started. First, if you move your cursor over to the bottom of the screen, you'll see 3 icons. Those are chat, raise your hand, and Q&A. Can everyone see and hear me? And if so, can you raise your hand? Oh, wow, perfect. Great. All right. Let's see. For the first few minutes, we'll have the chat enabled in case you have any technical issues, and we can help you with that. And we'd like to move through the webinar and answer questions at the end. So feel free to ask questions in the Q&A. And if you would like to ask anonymously, you can check the send anonymously box, but we'll get to those at the end of the seminar. And throughout the webinar, we'll be having some audience participation through polling. So we will go ahead and try our first one now. This is the first time I'm doing this, so be patient with me as I figure out these things together with you. All right, this is the first one. I'll give you a few moments to answer. But so far, everyone's doing pretty well. All right, fantastic. You guys figured that out really well. Here we go, share results. So 96% of you got the answer right. As your horse gets older, you will need to have more frequent floats to keep those teeth aligned. So with that in mind, we'll go ahead and get started on the presentation. All right, caring for the older horse. So today we're going to talk about caring of the older horse, and what that entails caring for the same things that they've had throughout their entire life. A lot of that is encompassed in our wellness program, so we'll touch on that briefly, and then your farrier service. Topics we'll talk about today include dental care, nutrition, Cushing's disease and equine metabolic syndrome, addressing basic lameness issues, emergency, and then we'll touch on quality of life and end of life care. All right. So to go over our wellness program, which is for horses of all ages, that includes 2 general exams in the spring and the fall with the vaccines, Coggins test, a dental exam, and a basic dental float, a level 1, fecal egg count, and then the vaccines listed there are the ones included in the 7-way vaccine and the rabies and Potomac horse fever. That's what we give in the spring. And then in the fall, we give the flu rhino. We do a booster of that, and that's included as well. We go over nutrition and weight management, and then you receive those results in the medical record sheet. Your additional savings with the wellness program are with imaging and blood work. The blood work's helpful because as the horse gets older, we like running chemistries on them, particularly if they live on an NSAID like Equiox for pain control for arthritis. I may recommend, or the other vets in the practice may recommend ACTH, which is testing for Cushing's, and the incidence of Cushing's goes up as the horse gets older. And then also insulin testing. If your horse has a crusty neck or something like that, we may be suspicious of equine metabolic syndrome, and that would be tested for with insulin. It's a blood test. Additional savings also on lameness exams, colic exams, additional vaccines, egg counts, and microchipping. Okay. So first, who are our seniors? Most people begin to consider their horse around 16 years old as a senior, but I kind of find that silly when we have so many horses living about twice that age now. We have so many more horses in our horse population living between 25 and 30 years old, and now some horses live well into their 30s. And usually the more petite the animal, the longer they live. So our mini donkeys and ponies, they tend to hit 40 with a little bit more frequency than our larger friends. A really important cornerstone of horse care is, particularly for the older ones, is dental care. And I think this is a part that really helps them have a good quality life long term. Horse teeth continuously erupt through the course of their adult life, and they don't grow new teeth at all after the adult teeth come in by 5 years of age. So if you look at the following picture, this is the skull of a younger horse, and you can see that they part away some bones, so we can see how long these tooth roots are. The horse has quite a lot of tooth left in it, so we know it's a young horse. That's why if you see us out pulling teeth, it's quite frustrating. Look at all that root down below the gums. Dental float is recommended for many adult horses, but once our friends get older, they have a higher incidence of abnormalities. So we may recommend twice yearly floats. Some horses do need them even more often than that, as these teeth are lost or expired. And an expired tooth, I'll mention that a few more times throughout this. It's a tooth still in the horse's mouth, but it's flat and smooth, almost like the surface of a marble, and it's ineffective at chewing. And here's an eruption chart for horses. So that helps us age your horse, and we know how old the horse is based on when these permanent teeth pop in. And based on the eruption chart and looking at the first incisor popping in from birth to 8 days of age, we can tell this little guy is not even quite a week old. He has no teeth. Too cute. All right. So I'd like to go over some photos of what I anticipate looking into an older horse mouth. So when I come out and do a float at your barn, you know what I'm talking about when we go over the horse's mouth together. Over on the side here, we have a normal adult mouth. This horse has beautiful alignment. There's no sharp, pokey edges, no ulcerations. Teeth are nice and aligned. That's beautiful. And over on the other side, we have something called a wave mouth. And as you can see, the teeth are one behind another, but they don't have a nice flat grinding surface. And that's something that we would address in a float to get it a little bit better aligned so your horse can chew more effectively. All right, and on this page, we have a little bit more of the abnormalities that pop up. You can see a hook with a misalignment of the jaw, letting that one edge grow particularly sharp. And then on the bottom, we have a step where there's a missing tooth up top, so we don't have that ability to grind that lower tooth down, and that's something that we need to keep in check. With a big tall step like that, they may be taken down over 2 floats. So that's where the importance comes of frequent dental checks for your horse. We may take things in a stepwise fashion. Over in the other photo, we have a good example of a expired tooth in the back. It's quite flat. There's no grinding surface for this tooth, so it's hanging out there, but unfortunately it's not doing too much in the way of chewing. This horse has some sharp enamel points, and you can see that it caused an ulcer. So that's something that your vet, myself included, may bring up. There are some sharp points and they've led to ulcerations, and we need to take care of those today by performing a float. All right, here's some more changes in a horse's mouth. As you can see, this horse's teeth are particularly sharp. They have some cuts, particularly on the tongue here. There's a bit of a wave mouth. So these are things that I look into an older horse's mouth and I may see, but with frequent checks, we can prevent your horse from getting to this point. And if we do get your horse to this point, that's okay. We do have the ability to do corrective flotation. All right. And this is a condition that happens in older horses, so I wanted to bring it up and get it on people's radar. EOTRH, it's much easier to say than the full disease name, equine odontoclastic tooth resorption and hypercematosis. And that causes the incisors to resorb, which is quite painful. There's no known cause, and there's also no good prevention for this disease. And the recommendation at this time is to pull the painful teeth. And it's alarming to think about having your horse miss incisors, but these horses do quite well once the pain has resolved. They're still able to eat hay, they can graze to some extent, they can go on and live normal, happy, pain-free lives. All right, next part after dental is nutrition. So I'll start the next poll for us. Okay, there we go. I'll give you guys 30 seconds. You guys are voting very fast. All right, fantastic. Good work again, guys. Your horse can survive without chewing long strands of hay, so that is true. Very good. Okay. So the diet for your horse in particular will be based on the amount of teeth it has left, your horse's workload, metabolic status, and the ability, of course, to chew hay. Horses with good teeth should be getting most of their calories from hay and or grass with a ration balancer, and sometimes the ration balancer isn't even needed. And as a horse ages, consider switching to something called a complete feed. We'll touch on that on the next slide. And this means that you don't need hay. The benefit of this is if your horse comes to a point where they have all expired teeth, or some horses have no teeth, they can still survive on everything in that little pellet to maintain weight and have a good life. They don't need the hay part. Often the hay becomes hard to chew and can lead to choke or colic, and having shorter hay like chopped hay can help in mild cases. And then if we have a horse with more advanced teeth loss, we would talk about something called walkie bulky. It's at the walkie feed mills, hay pellets, or soaked hay cubes. And soaked hay cubes are a fantastic source of nutrition, but if they're not wet thoroughly, they make a very good choking hazard. They're the size of an esophagus. Those are chokes that are quite hard to resolve. So they're a great product, just soak thoroughly and be cautious about feeding that to your horse. Okay, so on this slide, I have a list of several complete feed examples. And as you can see, there's several from different manufacturers, and there's so many more. So whatever senior feed that you pick is fine. We just need to make sure that it's a complete feed and it's appropriate for your horse's metabolic status. So if your horse has PPID, which is Cushing's disease or equine metabolic syndrome, they need a low non-structural carbohydrate feed. So that's a fancy way of saying it's a low sugar, low starch feed, if any pelleted feed at all. But if they have advanced dentition issues, then they'll need to be on a mostly pelleted feed, but it just needs to be the kind approved for these metabolic horses. And then something I always refer to when making feed recommendations on a complete feed is go to the manufacturer website and have an idea of how heavy your horse is, so you know how much to feed. With these feeds, there's a minimum on there, so your horse is receiving the appropriate amount of minerals in the feed. And there's also a recommended amount. Let's say you have a 1,000-pound horse that can receive no hay. For Safe Choice Senior, it may be around 12 pounds a day, but depending on how nutritionally dense the food is, it may be more or less, say, if you feed Purina Equine Senior as compared to Triple Crown Complete. So go to the manufacturer website, and that'll be a good guide on how to feed your horse with hay and also eventually without. All right. Next, I'd like to talk about a few conditions that do affect our older friends. The first is something called Cushing's disease. You'll also hear it referred to as PPID. Over on the right here, we have a horse that is showing a few of the clinical signs: shaggy coat, laminitis, which is an inflammation, particularly of the front feet, lethargy, polyuria, which is a fancy way of saying urinating a lot, polydipsia, the fancy way of saying drinking a lot, sweating, loss of condition, and weakened immune system. The weakened immune system particularly plays an important factor in developing abscesses. So that's something I frequently hear, that my horse develops recurrent abscesses, and maybe we'll look at the horse's coat, maybe they won't shed out too well this year, and we consider running a test for Cushing's. This is diagnosed via blood test. Usually it's a one-time blood draw, but if we have a horse that's stealthy about its Cushing's disease, we may need to come back and do something called the TRH stim, and that's a two-step blood test. We draw blood, and then we give a drug, and then we draw more blood after the test. So it can all be done in one visit. If your horse is diagnosed with Cushing's disease, there's a drug called Presend out on the market. It's the only labeled treatment at this time, but there's a few other drugs. So if Presend doesn't end up working for your animal, there are some other tricks we can pull out of our sleeves. Next one is also a endocrine metabolic syndrome, equine metabolic syndrome, very uncreatively named. Clinical signs of this include insulin resistance, fat deposits, and laminitis, and this can also be diagnosed via blood test. And over here we have a horse that is highlighted and has the areas where those fat deposits show up. So if your horse has a large crusty neck or a fat deposit over the tail head, myself or one of my fellow associates may be talking about, okay, is this equine metabolic syndrome? There's several drugs out on the market to maintain this disease. Just like Cushing's, there isn't really a cure. It's more of maintenance, and thyroid powder tends to be one that we gravitate to when treating this disease. But depending on your horse, we have a few more options for this one as compared to Cushing's. All right. Another common affliction of older horses is arthritis. I tell people arthritis is a slow moving train. You're not going to stop it. It just is a degenerative condition, and it happens. There's multiple therapies available depending on the location of the arthritis and the degree of your horse's lameness. Injections can help in the beginning, but there are some limitations. Putting steroid in the joint slows down fusion, and it also becomes quite difficult to inject a joint once there's advanced arthritis going on. A lameness exam and x-rays can help tell the extent of arthritic changes in your horse. And over here we have a picture of one of the common drugs that we use for managing arthritis. That drug is Equiox. It's a low painkiller that a horse takes every day to help manage the pain affected by arthritis. All right, and I think it's time for a poll. Let's see. Perfect. All right, fantastic. The safest place for you near a down horse is probably the fourth choice that I didn't put in there, is far away. But yes, standing behind the neck and the head is the safest place if you need to approach a down horse. Behind the horse isn't safe because they can still kick. Several of them do try and paddle on their backs, particularly if they're struggling to get up. So that's not a safe place to be. And never ever walk by the hind or front legs. They can reach out quite far, as almost if they're in a gallop position while lying on the ground. So you're not safe if you're near those legs. Stay towards the back or the neck or the head, but preferably towards the head. Very good job. Okay, so some emergencies that happen to afflict our older friends are increased risk of choke, unable to rise, also called a down horse, laminitis, not eating or weight loss, and unfortunately, an increased risk of surgical colic. And surgical colic is always a really tough situation to deal with out in the field. So to better prepare you guys, I would love for you guys to plant the seed in your head and start thinking about, does my horse have the ability to be referred? And if my horse has the ability to be sent to a referral hospital, does my horse have the option for surgery? Whatever you decide is okay. We are going to support you no matter what, but it's much easier to make a very difficult decision in a non-stressful situation. So I wanted to plant that seed so you can think about it. There's no right answer, but it's helpful to have a decision made prior to an emergency situation. Over here, we have a horse experiencing choke. Usually the snot starts pouring out of their nostrils. As you can see, feed material, a lot of saliva, your horse will be gagging. If you see that, that's choke, give us a call. We'll have to pass the tube on your horse. And then for a down horse, keep safe and get help. There's always work on the backside of the horse. Something that may be helpful is providing good traction, whether that's putting hay, straw, bedding, sand, the like underneath the horse's feet. This has been a particular challenge in winter. The horse goes down on ice. So any way we can get good traction. Getting control of the horse to some degree, having a halter on may be beneficial to help guide your horse up. Flipping a horse, this is something to be done with either the aid of the veterinarian or someone that has done this before. Flipping the horse over onto their back and onto their other side may allow them to rise. If things are getting really difficult, we may have to use straps and heavy farm equipment to help move the horse. And as always, we are a resource for you if you have a horse that is down. If there's a structural damage or an environmental hazard with your down horse, consider calling the fire department to help get control of the situation. And we'll be out there as well to help orchestrate getting your horse out safely. This is a lovely photo of everything going right. There's people wearing high visibility jackets, helmets. They're in a big open area where they have a lot of room to work. Everyone's on the back side of the horse. Everyone's staying safe. I know this is not usually how things present in the field. Horses get themselves stuck in sticky situations, but this is a lovely picture of the ideal situation. Make sure I didn't skip a picture. I didn't. Perfect. Next condition is laminitis. So this is a condition involving inflammation of the tissue inside the hoof, leading to bone separating from the hoof wall. The laminae are kind of like the Velcro that keep the hoof wall and the bone together. So when we have laminitis, we have a breakdown of that sensitive tissue. There's a variety of causes, including diet, trauma, illness, and metabolic diseases, including equine metabolic syndrome and also Cushing's disease, which we touched on earlier. This is an emergency for both your veterinarian and your farrier. I would recommend calling your vet, and then we would come out and assess the situation. In many of these situations, we would recommend taking farrier views, which are images of the front and the side of the foot using the x-ray machine, so we can see what is happening inside the foot capsule and with the bone. And from there, we can instruct your farrier and provide suggestions on how to better treat your horse and alleviate that discomfort. In these cases, we'll talk about bedding deep and getting your horse on bute or Banamine so they can be more comfortable during this inflammation. It's quite painful. On the picture over here, we have a horse doing something called the laminitic stance. I try to explain to owners that this is like your horse trying to do a downward dog position in yoga. They're trying to rock back onto those back legs and get as much weight thrown on the back end of the horse rather than on those front feet, which are quite painful. So they'll put their feet out in front and they'll squat with those back legs and throw all the weight back there. This is a classic sign and good for the horse owner to know. So if you see your horse doing this, give us a call. It may be laminitis. With this, they're very painful on those front feet. They'll walk gingerly. All right. Unfortunately, something that horse owners are all too familiar with are colic, and it's always good to know colic signs, so we'll go over them together here. Restlessness or depression, kicking at abdomen, looking at or biting sides, going up and down. Usually this is quite a panicked going up and down, rolling and thrashing, pawing at the ground, fever, and then later severe hypothermia. High heart rate and panting, horses that are off feed. Horses can be off feed for a variety of reasons, one of those being colic. Parking out, which is when the horse, it's almost the opposite of a laminitic stance. They park those back legs out far behind them and they stretch their abdomen. Profuse sweating while standing still. And then something that happens in geldings, they'll urinate small amounts frequently. And that's one of those subtle colic signs that is easy to miss. But if you notice your gelding urinating small amounts frequently and doing a few of the other aforementioned signs, this is a sign of colic. It's time to give your equine vet a call. And on this slide, I have a list of referral centers. So with colic, you would have one of us out and we would perform a colic exam, and then we would usually rectal your horse and pass a tube and provide a few other tests depending on what we're thinking. We may run a lactate, which is a blood test, or a serum amyloid A, a different blood test. We'll assess your horse's heart rate, and we'll discuss all of our findings with you. And we may say that the best option for success for your horse is referral. And referral is sending your horse to one of the local clinics listed here. I made this silly little map so you have a rough estimate of where these hospitals are. They're all very good clinics and they all have the ability to take your horse 24/7 and work your horse up for colic, and all of the listed locations do have the ability to perform colic surgery if that is something you pursue. A question I get asked when I'm working up a colic is, well, when do I send my horse to a referral center? And the answer is as soon as possible. If you can get on the road and on your way as soon as possible, that's the best chance for your horse to have a positive outcome for a colic episode, particularly a severe one. Time for another polling question. This is a tough one. Colic is a disease that can be prevented. Ooh, you guys are pretty split. All right, guys, this was a very tough question. Here we go. Okay, colic is not a disease. It is a symptom that something is going on in your horse. So we could be talking about ulcers, we could be talking about gas, displacements. I've worked up horses for colic and they had liver disease, they had a bladder stone. So colic is not a disease, it's a symptom, and there are some parts of this symptom that can be prevented, avoiding stressful situations and the prevention of ulcers, um, things like that. But unfortunately, a good amount of colic is luck of the draw. There isn't really good preventions to prevent some of the more serious types of colic, such as intestines going out of place. All right. And assessing quality of life. This is a really tough conversation, but I think it's important that we have this conversation together so we can think about it in a less stressful situation rather than at the time of your horse colicking or something like that. Quality of life is different for each horse. You know your horse best. We do see your horse quite frequently, but you know your horse best. Some qualifiers for me is most horses enjoy eating and are comfortable moving around and interacting with other horses. And those are three pillars that are pretty important to me when I have conversations with owners about quality of life. Something I'm also concerned about is maintaining weight. As we talked about earlier in this talk, there are some things we can do to assist with having your horse keep its weight up, whether it's a complete pelleted feed, liquefying some of its food, keeping those teeth in check, things like that. Those are all important things to factor in, is your horse having a good quality life. And then with the rough winter, that's also something to consider. Is winter going to be too hard for your horse? We like horses a little bit chunky going into winter because it is quite difficult. So that is something to assess for deciding on your horse's quality of life. Here's another poll for you. All right, last poll. All right, good. All right, so many of you know where your closest referral center is. If you don't know where that is and referral is not an option for your horse, that is perfectly okay. As long as we've made that decision and we've talked it over, it's perfectly acceptable. We're here to support you. And thank you. No one picked that I can perform colic surgery at the barn. Simply not something that we can do together. That's something for a referral center. Good work, guys. And the last page is the last slide, quite a difficult conversation, but we'll get through it, guys. Aftercare for your horse. So some owners ask about cremation. I did recently call the crematory service. It's called St. Francis Pet Crematorium, and it's in Northern Illinois. The prices are listed below. The company that either picks up your horse and it goes to cremation or not. The one that we pass the number out to most is for Briar Hill. There's a gentleman named Roy. He's great to work with, and we usually recommend calling him. There are a few other horse services, and if you have one of those, that's perfectly fine. And something I'd like to remind owners that losing your pet's very difficult, and if you would like a memento to keep from them, many owners take mane and tail, and I feel like there's more and more options out on the market, and here are a few that I put into Google and was able to come up with, and there's a lot of really nice options to memorialize your pet if you decide to go that route. Thanks for joining us tonight. We're gonna go ahead and answer some of those Q&As. I know we touched on a lot of information and a lot of tough information. So thanks for sticking with me, guys. Thanks. Ooh, Tina, good question. Tina's question is, how often do horses present with rear foot laminitis? Not very often. Usually it's both front feet presents first. And rear foot laminitis is something that happens very long after the front feet. If we have a horse that is foundering and presenting laminitis in all of its feet, so front and rear, we're dealing with a horse that's extraordinarily sick. Those horses are usually what we would call septic, so they have a bacterial infection in their blood. That's a very serious condition, but a very good thing that you brought it up. Thanks.
I was just going to add on that. That is a good question. I did read an article, interestingly, that looked at the inflammatory products that occur in active laminitis, and they actually tested hind limb and forelimb, and they were equal presence, but the difference, they really, you're right about it. It's rare to see hind end, but they just think it may much depends on the weight bearing. That just probably 60% of a horse's weight, or 55 or more, is on those front feet, and that makes all the difference. So I guess the take home message I got from that, because I always focus on the front more, is that if you ice your front feet on the horse, and you can, maybe you ought to be icing the back feet too, because if you get into a chronic laminitis over time, those hind feet actually are getting insults. But we're pretty lucky. Most of the time we don't see the back end in trouble like we do the fore end. But I just thought I'd mention that.
Okay. All right. This is a interesting one to answer. The back hoof wall is flaking and absorbing dirt in the bottom area. My farrier suggested using Geriatric hoof hardener. He will be 19, has never had this happen before. Is there anything else I need to do? I have used Geriatric before. It is a nice hoof hardener. If it's coming from the bottom of the foot, there's a supplement called Farrier's Formula out there that has pretty decent reviews, and that can also help with the growth and maintenance of your feet. Does anyone else have anything to add to that?
I guess all I would say is I agree with you on everything you said. I do think sometimes we'll see horses when we've had a lot of moisture, and then they go into the stalls where it's dry. It's kind of like doing the dishes every night, like your fingernails, and that's really what their hooves are. And individuals will start getting cracking and flaking. And sometimes it's a little controversial, but actually just painting those hoof walls, not only with Keratex, but even with like a aloe, or there's escaping me. There's several products, but a moisturizer even. They used to use bacon grease. I don't know if that's fallen out of favor, but that may actually help. And then maybe hopefully it's a superficial situation, but I think it's good to keep an eye on it. Yeah.
I've heard butter, but I think that would attract too many flies.
Yep. Olive oil.
I haven't heard of mineral oil for feet. Has anyone else?
No.
No.
Yes, I haven't. It might act as a barrier too, potentially. Because probably some of those products aren't going to really penetrate into the outer keratin totally, but that might be useful. Yeah.
You mentioned a ration balancer. Can you elaborate? Sure. So when we have different types of horse feed, there's multiple on the market. And if you look on your feed bag, there may be a recommendation for feeding your horse with forage, and that would be a ration balancer. So it's a supplement to a horse that's receiving most of its calories and nutrition from a hay product. When we talk about complete feeds, we're talking about a type of small pellet that can entirely replace all the forage in the diet if need be, so any type of hay. I hope that answers the question. A ration balancer supplements the diet, whereas a complete feed totally replaces the amount of hay in the horse's diet. Any other questions? I think one just came in. Is tea tree oil okay to use on hoof cracks up by the coronary band? I haven't used tea tree oil. When I have a crack up near the coronary band, it matters what direction the crack is going. If it's running parallel to the ground, that's usually a old site for an abscess rupture. And something I've put in those is a little product called Thrush Buster. You can pick that up at a Tractor Supply store, and it helps prevent dirt and bacteria setting up shop in those hoof cracks. If we have one that is perpendicular to the ground, that may be something that needs to be addressed by your farrier, because it may sound like your hoof is splitting apart. Does anyone else have familiarity with tea tree oil?
Can't say that I do. I wouldn't think it's a problem. I mean, it has a lot of antibacterial applications. Sometimes with any product, I guess at the coronet, remember that is skin. You know, the hoof seems pretty durable, but sometimes if you're trying something new on just any individual, you might start with just a little spot and make sure you don't see some crazy reaction. You never know once in a while. Individuals, that's all.
Good questions, guys. Any more? Very good insight, Nancy. Chokes on her feed, and then she pre-soaks her pellets which is great. More water in there, the better. Very good. Let's see if I'm missing anything else.
A lot of times on those horses too, I like to spread out the feed. Like I'll even take it where you have a whole section of the stall that's cleaned and you spread out the feed so they can't bolt it, or you put rocks or something, big rocks in their feed bucket so they can't eat it as fast. They have to slow down. So oftentimes that will also help.
The boulder trick is great. Putting that in a feed
Yeah.
pan. Love it.
I guess the only other thought too, if you feed your horses together, there are sometimes horses with other horses close by. I have even 2 mares at home, and I've learned to put their bowls at opposite sides of the stalls, because if I'm lazy and they're next door to each other, there's so much more, chomping and up and down, and it's kind of ridiculous. But so that can be another thing. Competition around feeding time can speed up choking or increase choking, but that's all.
Last calls for questions.
Right, maybe we got through it.
Great. Oops.
Oop.
Oh, thanks, Leslie.
Hi, Leslie.
All right. Very good. Thanks for joining us tonight, guys. And tune in next week for Dr. Slater's presentation. That's on March 10th, Grazing Strategies and the Metabolic Horse. And then on March 17th with Dr. Stoll, Save Time, Money, and Heartache with a pre-purchase exam. Thanks for coming.
All right. Thanks for everybody attending.